Good evening, everyone. Has everybody gotten a chance to join? Are we still people are still signing in?
People are still joining,
Okay.
but I'll go ahead and start off with our
No, that's
welcome.
fine. If they're still joining, I'll wait till you kick it off.
Alrighty then. All right, we'll just give a few more seconds to allow more people to join us. Alrighty, I think I'll go ahead and get started then. Hello, and welcome to SCO's June webinar on our curriculum and academic program. Thank you all so much for joining us. I hope you are staying safe and healthy. My name is Avery Cunningham. I'm a Student Services and Admissions Officer here at SCO. I'm one of the admissions team members who answers your admissions questions and participates in the admissions process. Before we get started, I ask that we all use proper Zoom etiquette by keeping microphones muted unless speaking, limiting background noise, and respecting all of this webinar's attendees and facilitators. We will have time for questions towards the end of the webinar, but in the meantime, if you do have any questions or concerns that need immediate attention, please use your chat feature to communicate with us. Today, we'll be discussing SCO's curriculum and academic program. Led by Dr. Elkins, our Chair of Optometric Education. You'll hear what you might be exposed to as a student here at SCO, learning about our mission, our facilities, and what makes our program unique. This webinar is being recorded and will be free and available to view starting next week on our website. And with that, Dr. Elkins, I turn it over to you.
Thank you so much, Avery. Thank you all for being here this evening, and to Avery for coordinating this effort. As she mentioned, I'm Dr. Lindsay Elkins. I am the Chair of Optometric Education at Southern College of Optometry. A little bit about me: I am from North Carolina originally, and I went to the UNC Chapel Hill. After graduating with my degree in biology, I came straight to SCO, and after completing the 4 years at SCO, so I graduated from SCO as well. I did a residency, which we'll mention a little bit about residencies in the future, at the Memphis VA, and then I came right back to SCO as a faculty member. I've taught in our primary care clinic, some of our theory and methods labs, and since then I've slowly gotten more administrative exposure. And now I'm the Chair of Optometric Education, which means I make the course schedules and I oversee the day-to-day aspects of the curriculum. So I can really answer any of your questions you might have about the curriculum. But this is just going to be a quick overview of everything, just to give you a little bit of a taste of what makes SCO unique, like Avery said. So our mission informs everything we do at the college, and our mission is to lead the profession by educating the best possible healthcare providers, promote lifelong learning, and fostering a personal commitment to service. And having these aspects of our mission really do make us unique. Of course, we want you to be the best clinicians to be able to provide healthcare in whatever situation you may be in. We realize that we're giving you the foundation to start your career, but you've chosen this as your career, so it will be for life. And there's always more to learn, which is one of the reasons I love being in the academic environment, is we're always encouraged to learn, and it's part of my job, and we have to, but it's going to be part of yours as well, even as you're a practicing doctor. So we have to give you the skills that you're going to be able to learn for the rest of your life. And it especially makes us unique as our commitment to service. So you will have service learning as part of your curriculum. SCO has always had a great community service atmosphere, and so we decided to formalize that to actually give you time in your curriculum and require you to do some service throughout the curriculum. We'll mention that as well. And there's still plenty of service and volunteer and student organizations that go above and beyond what's even in our curriculum. So one of the big things that's going to be different about this graduate program is there's a lot of content. So our curriculum has over 192 semester credit hours of coursework. And as you know, the semester hours, that's just the time you're assigned to your lectures or your labs or your clinic. The time you actually spend in labs is actually twice the credit hour, and clinic is actually 3 times the credit hour. So you spend a lot of your time in performing the curricular activities, and you always have to, there's more time that will be needed to study or practice. And so it's really great to have a good atmosphere. SCO, we're pretty unique in that we are a standalone optometric institution. And so we're all optometry all the time, and you're going to work very hard, but it's going to be very rewarding. So Tennessee is where we're located. Hopefully, you know, we're in Memphis, Tennessee. We're very fortunate that Tennessee does have a very broad scope of practice, which that just means optometry is a legislated profession, and it's different depending on which state you decide you want to practice in. And so we educate students to the highest level they would need to go back to any state. One of the things that we are currently expanding on is our lasers curriculum. So even though in Tennessee, optometrists cannot perform laser procedures on patients at the moment, you can in Mississippi and Arkansas, which are very close to Memphis. And we've even expanded beyond just the didactic curriculum to have an ophthalmologist that we partner with 1 day a week, that our fourth year students actually get to perform laser procedures as part of your curriculum in your fourth year. So we've really expanded that. But in Tennessee, we've had orals and topicals and injections. You'll do intralesional injections on eyelids on each other. You do that in your second year. So we've had that privilege since the 90s. That's where most of the states are currently expanding. And so we want to make sure you're practicing to the highest level, but even if surgery and those medical aspects are not what you're interested in, vision therapy, contact lens, it's full scope. We make sure you have everything that you need to be a great clinician in whatever area you want to go to, whatever state you want to go to. So our clinical education, we have you're going to have a great exposure in our internal clinics, your externs, and we even have external clinics within Memphis to give you a lot of extra exposure. So the Eye Center is our main clinical program, and it's attached right to our 11-story tower. So our campus is an 11-story tower where all your classes take place. All the administrative buildings are within that one building. And then attached to it, so you just walk over a breezeway, is our clinic. It's our main clinic. As in your third year, and in your fourth year, you'll have mostly the specialty clinics, but primary care is in your third year. And then as you go into your expand in your third year and fourth year, you'll go into the contact lens, vision therapy, low vision, pediatrics, teen clinic, advanced care ocular disease. So that's all of that's within our Eye Center. To give you a little bit more of a different feel, we have our University Eye Care Clinic, which is actually at the University of Memphis above their bookstore, so that you see other young, healthy adults that are not your lab partners, but also serving that community in the university field. Focal Point is another external clinic in Memphis. So these are only a few miles away from the main campus, so it's not a large commute. But in Focal Point, it's set up more like a private practice and boutique feel. So it's an art gallery inside, and they have a specialty optical and all the equipment that's there. We actually share that space, though, with Church Health Center, which is an entity that provides sliding scale care for the working poor. So it's a very interesting dynamic that we're able to all work together in that situation. And so you get a very broad and diverse exposure clinically. And at the bottom, we have the optometric surgical procedures and laser lab highlighted, because that's been a big area of expansion within our curriculum. Just in the last couple of years, we added a new class. So as I mentioned, we've had lumps and bumps and injections privileges since the 90s. And so we've always had that in the curriculum, but wanting to expand on that a little bit more and give you even more laser exposure and perioperative management. So even though you'll get proficient at being able to perform these procedures, and of course the lasers and cutting things you'll do on models, you don't have to do those things if you don't want to in practice, but you should be able to be prepared to co-manage if that's the situation you want to go into. But we have made steps to expand our curriculum in this area and actually added classes and labs, and we're still refining that to get you that exposure a little bit earlier in your third year so that you can work to actually perform laser procedures in your fourth year. So a big area of expansion for us. This is a quick overview of what our facilities look like. In the top left-hand corner, that's our main campus. When I mentioned that 11-story tower, that's that tall building. The other area in the forefront, that is where mostly the classroom complex, your classrooms are right in that area, and it's a nice atrium inside where those windows are, so you get a lot of light right outside the classroom. The bottom right is the internal view of that classroom. So you spend a lot of time in those classrooms, usually people to bring their devices, and that we can close that room in half so that we'll have either first year and third year classes going on at the same time in the morning. Second year classes are usually in the afternoon, and then your labs would be at the opposite of that. So the top middle picture is one of our digital exam rooms. So that's how most of our exam rooms look. What's special about this one is the left-hand computer on the wall, and you may see that it's attached to some additional equipment. So that's our digital exam room, is similar to the National Board of Examiners Part 3 exam room, in which they use all digital BIOs, which are the headlamp that you wear on your head to examine the retina. And so that has a wire that's connected to put an image up on the computer. And the slit lamp, which is the big microscope there, the slit lamp is also digital, so that you get to practice. This is actually in the eye center right now. You actually get to practice on equipment that's almost exactly like what you will have when you have to take part 3 of your national boards, because there are 3 parts of national boards, and you usually have to pass all 3 of those to get your license. You have to pass parts 1 and 2 to get to graduate from SCO. And so we want to make sure you're fully prepared, because these are very stressful tests, and especially part 3, you actually have to travel to North Carolina to take that test. And so we want to make sure you pass it the first time. On the top right-hand corner, that's actually in our theory and methods lab. We do have demonstration slit lamps where we can put an eyeball up there that we're looking at in the microscope in that slit lamp and show students that we're teaching the procedures of how to examine the structures and what you're looking for. The bottom left corner, this is actually one of our surgical partners, one of the ophthalmology groups that we partner with. That's one of the laser slit lamps that we do have an observation room where students can observe, but really we've moved beyond just observing to get our students more hands-on procedures. So of course, first you'll work on models, and then you'll have a rotation with a surgeon 1 day a week, and in your 4th year to be able to perform some procedures. So that's a quick overview of the eye center and your main campus. So as far as how this is different from undergrad, we've already talked about it's a lot, the greater amount of content that you have. So usually you would have, maybe the highest credit hour you take in undergrad is 18 credit hours, and not everybody takes that many. Well, this is all geared towards your degree. And this now we're taking up to 21 to 24 credit hours in a semester. And there's a lot of hands-on components in your labs. You're going to be tested, but also you have to perform your procedures. So the practicals, that's a different aspect that most people haven't experienced in their undergrad experience. And also you can't just really cram for a test and then forget it, because it all builds on each other. So that's that tight integration. It all gives you the foundation to take the next step, but you may be tested on something in your 2nd year that you learned in your 1st year, or 3rd year that you learned at any point in time. So you really have to be prepared that you would have to be tested on those things at any point in time, which actually part 1 of national boards, which you take in the spring of your 3rd year, it's called the Applied Basic Science Exam, and they test you over everything in your first 3 years. So it's important that we simulate that environment, that an integrative environment all the way through for you. And we also keep that sharp focus on our mission. So again, we want to make sure you're not only can you pass your boards, but you're going to be a good clinician. So you have to be good at the basic science. You also have to be good at what makes you a good doctor, applying what you learn. So again, you can't just memorize things and dump it for a test and then be done with it. So I know you're working really, really hard right now to make sure you get the best grades so that you can get into a great school, and grades are still important, but you also have to be a good doctor. And so sometimes it's not necessarily about the points that you get, but making sure you get the point. Okay. And also keeping them in the mind the ultimate goal of educating the best healthcare providers. Again, that's essentially what I just said, that you have to be the best well-rounded doctor. There are going to be courses that you have that have nothing to do with national boards, like your public health or evidence-based medicine or the business side of things, practice management. A lot of those areas, it's just about how to be a good doctor, give back to your community, the service aspect, but it's important for educating the best healthcare provider. So we don't want you just to get through and get a good grade on your tests. We want you to be a great clinician and successful throughout your entire career. So this is a little overview of the 4 years. So in the first year, it's just the fall and spring term. We are on a semester schedule, and this is very basic science heavy to form those foundations. Again, if you have those foundational aspects, whatever comes out that's new, you'll be able to apply it and understand it through your anatomy knowledge or physiology knowledge, all the basics of vision science and optics, so that you really get a good foundation. But you do in your very first semester start learning clinical skills. So you'll get your diagnostic kit, which is your first piece of equipment. You'll learn how to do retinoscopy in that very first semester. Retinoscopy is how you, without someone speaking at all, can get an estimate of someone's glasses prescription. And honestly, that's something we use. That's a core foundational skill, because we do service populations that can't talk to us, like infants or other people with different disabilities, or elderly, or just people that don't want to talk to you. Sometimes that's just teenagers. So it's important that you're able to use your objective skills to be able to take care of your patients and influence their quality of life. So you start learning those skills day one. And so our theory and method sequence is where you're learning, putting together the aspects of a basic exam all the way through the curriculum. Second year, so after you finish the spring of your first year, you do have a little bit of a summer. So in May, the semester would conclude, and then you have a little bit of a break, and you come back for what we call the mini term, which is cute, but it's a very quick 6 weeks, starting in July, where you have a handful of classes that you have every day. So it's very intensive for that 6 weeks. And you have another theory and methods lab where, again, you're expanding on the skills you've already learned to really get you jump started so that you can move on into the second year. In the fall of your second year, you will have your first clinical communications and patient care course, which part of that is doing school vision screenings. So that's your first time you're really going to use your skills on people that are not your lab partners. And this will be preschoolers all the way up to middle schoolers, high schoolers as well. And just being able to use those skills. I used to coordinate the school vision screening program, so it's near and dear to me as well. But just being able to adapt, because you're so used to working on each other as partners, that just adapting that communication is really helpful, and it's great practice for you. And it's providing a service to the community, because if you can't see, you can't read, you're probably not going to do very well in your courses. And it's amazing what people go through life just adapting to. So yeah, you also have interprofessional education, where you'll learn about how we work as part of a healthcare team. Optometry is not the only healthcare provider. Of course, we're the primary eye care provider, but working with other professions, you can influence someone's quality of life in a more holistic way. Pharmacology and pathology, again, that expands on some of your basic science applications. And evidence-based medicine gives you an insight into how research is done to some degree, but also when there's new medications that come out or there are clinical trials, how you can evaluate those studies that are presented to you to see if they're valid studies. How were they designed? How do you know that they aren't, it's just not a sales pitch that's wrapped in study language, so that, again, you'll have those skills so that you can critically apply information for the rest of your life. The third year is where you really start to see patients at this point. Summer of your third year, you are in adult primary care clinic. So you have your own clinic assignment doing comprehensive exams. This is after having passed a clinical checkout procedure. So you've learned all of your clinical skills. You've demonstrated the proficiency on other people. And so now you're really going to get into clinic. And during your second year, you'll also get to scribe in clinic for upperclassmen. You'll observe in the clinic. So you get a lot of clinic exposure even before your third year. But the third year in that summer is when you're really responsible for the entire comprehensive exam. You're assigned to a staff doctor. I still see patients in our adult primary care clinic. That's one thing that's unique about SCO is all of your doctors, even the ones teaching your basic science classes, anatomy, physiology, all of us are clinicians. We're all ODs ourselves. And so you'll also have the opportunity to have us as your staff doctors in clinic. And how that's a great benefit is even if it is something that's basic science, we can tie it to actual clinical cases, which as someone who's going to be a clinician helps it sink in a little bit better, helps you be able to apply it a little bit longer. So clinic is a lot of fun, but it's a lot of hard work as well. And you still have classwork. So you still haven't, you're not done learning everything, but we're there to support you all the way through. You'll get your strabismus and amblyopia, glaucoma, integrative clinical analysis. That's really when you're putting it all together and you're having to apply it. Vision rehab, neuro eye disease, and the surgical procedures courses are in your third year as well. You'll also get your first exposure to national boards because that is in the spring of your third year. And that's for everyone. SCO doesn't decide when that is because it's national. But spring of your third year, you take part one. And so that's usually the semester where you have the fewest credit hours for SCO, but you still are in clinic, you still have classes, but you have a lot more time because you also have to study for that exam. And again, majority of your on-campus time is in the eye center for that. And that's a trend. So first year, you're very lecture and lab heavy, second year as well, but you're getting more clinic exposure. And then each year you get more clinic. Fourth year is entirely in the clinic. You have a business seminar that runs every other week when you're on campus. And when you're on your externships, you have some assignments that you do, but there's no formal class anymore. Our externships, our fourth year is split into 3 rotations, and it depends on which ones you select. You can be on campus for your internship, either summer, fall, or spring. And then you decide where you're going to go for your externs, which are all over the country. Some are even in Alaska. So it's a fun time. A lot of people go back home where they're going to determine where they want to go practice, or if it's their last time to explore, they make the most of that as well. But a whole lot to choose from with that. But you choose one private practice and one institutional practice, which an institutional practice can be hospital-based or a co-management center. And then again, you have the one internship at SCO. And usually students, if the class will have a spreadsheet, and so they put their top 3 choices and students kind of work together. If you want to go fall, then I'll try to go spring and things along that line. So usually people can work out getting their top choices, but they're all good. They're great learning experiences. Okay, I already mentioned that our commitment to service is another thing that makes us unique. SCO does have a long history of service. You may have heard of VOSH, which is Volunteers in Optometric Service to Humanity. Well, SVOSH, or SVOSH is what we call it, is Student Volunteers in Optometric Service to Humanity, and it actually started at SCO. And so this is when you do service all year long, usually in conjunction with the Lions Club, to raise money and collect glasses, and try to get the glasses in good shape. And then we go to select countries to provide mission trips and eye exams to people, usually coordinated again by the local Lions Clubs that are there. And it's a great experience. When I was a student, I went to Costa Rica. We did exams, all day long for several days. And then there was a fun trip we had the option to do at the end. And it was a great experience. And I think I went in my first or second year. And when you're that early on in your career, those volunteer opportunities are so important for just getting to practice your skills and again, providing a service to someone. So the benefits to you clinically and personally far outweigh that service you're providing, but you are also impacting someone else's life. So it's great. You also have the school screenings that we talked about, other local screenings. And if you don't want to travel abroad, you don't have to. Or if you want to spread your impact, there are RAM trips, which are remote area medical trips. And it's similar to SVOSH, but it's stateside. And usually it's somewhere that's within driving distance. It's usually a pretty good drive, but it's going to be somewhere where there's a rural population or just a generally underserved population. So sometimes Memphis even qualifies. We'll have sites in Memphis, but usually it's a day's drive. And again, your people just line up around the block, and it's just so impactful to see how much need there is, which is devastating on one hand, and on the other, you're providing a service, and you stay there until the work's done and you take care of everybody. So it's amazing. And you partner with local optometrist office so that you can transfer the care from there. So not just a one and done. There are additional opportunities for service for all students. And we do faculty and staff as well. We do usually have a service day, which we just had an SCO service day in the last month, where we chose local entities to go out in teams and work with other faculty and staff members. That was a great time. Students do things along that line as well. In accordance with our mission, we've been working to formalize a dedicated part of service in our curriculum. So the service learning, we do have a director of service learning, and this was actually student-led. I guess it was probably about 10 years ago now. We were trying to find a way to enhance our curriculum. We went to student, staff, and faculty to see what could we do to be impactful in our curriculum. And everybody enjoyed doing service so much. And it was already something people were dedicating so much time to. There was actually a student initiative to make it part of the curriculum. So that's the vision screenings are part of that, the school vision screenings that you'll do in your second year. But also we have a Saturday service experience that you'll do during your third year, and potentially have the option of doing your fourth as well. But usually we will partner with a community entity. Lately, it's been one of our centers that deals with addiction, people suffering from addiction. And we'll have a learning opportunity with that organization to see how that impacts vision and their activities of daily living. And then during the Saturday service experience, you will provide the eye exam, but you're also with that individual from the start to the beginning. So they're when they check in to when they check out, even and in addition to they're doing their exam, and usually there's a meal shared. So it's a more impactful experience. And I mentioned this already, the optometric lasers and surgical procedures. So you do have a class in your third year that's the optometric surgical procedures, which is more focused on the lumps and bumps. You get a little bit of that in your second year, your anterior segment course, where you will do the eyelid injections on each other. In the third year, it's more focused on practicing those skills again and injection skills exam, so which is your IV injection, because there is part of that on boards as well. And different states have requirements for passing those as well. The surgical procedures, though, is more focused on incision or excision and curettage. So where you are cutting open lesions, making sure that you can seal them up with sutures and that you can treat it appropriately. So, and you do get a review of the surgical anatomy with that. So a little bit of anatomy refresher in the fall of your third year. We've actually just voted to expand that to bring some of the lasers procedures into the fall of your third year as well, so that you can go ahead and start learning some of the laser aspects, and in your clinical time during third year, go ahead and start practicing on some of those laser eye models during your third year. And then in the spring of your third year, it'll expand on the lasers and perioperative management, and of course the co-management aspect of cataracts, any of those surgical procedures, so that then in your fourth year, you are ready to come back. When you get to your fourth year internship, again, you'll be able to be assigned to those optometric surgical suites, where you will help do pre and post-op cataract evaluations, and then any of the laser procedures that we're including YAG capsulotomy, SLT procedures, things along that line. So this will also prepare you to take any of the MBO exams that are the LISP is the laser surgical procedures exams. And again, ISE is the injection skills exams. Now, right now, no state requires LISP to get your license, but that could always change. Every state's different with their Board of Optometry, but several states do require you to pass the ISE. So you'll be fully prepared for that through SCO. So after this 4 years, you're going to work really, really hard, and the end result is you will achieve your Doctor of Optometry degree. So you've taken all the classes, you've passed all the practicals, you've passed your parts 1 and 2 of your NBO exams, 3 as well. We hope that's a rolling exam that you take, and then you get your degree. And then you work with your state, whichever state you want to go to get your license, and you will be ready to practice optometry. So SCO, your degree does not grant you a license, but you will have to have a degree, an optometric degree from an accredited college of optometry before you can pursue licensure in any state. So it is important when you're already thinking about where you want to practice to kind of, of course, you don't have to make that decision right away, but every state's a little bit different. They usually have a law exam you have to take. Some of them, their law exam you have to take at the National Boards of Examiners in Charlotte, North Carolina, or it's an online test. It's highly variable. Some of the states you also have to take a written or oral exam or a procedures exam. But it just really depends on your state. So each state governs has their own optometric board. And so that's important for you to look at their requirements. And of course, SCO has some support there as well. But once you've gotten your OD degree, you can go practice anywhere. After you graduate, so as I mentioned, I did a residency at the Memphis VA. Residencies are not required to become a licensed doctor. Residency programs are completely optional. It is a postgraduate program, usually based on clinical training that lasts for 12 months. Residency programs are usually accredited by the ACOE, which is the American Council for Optometric Education. And so all optometric education programs, OD degrees, are also accredited by ACOE, as are the residency programs. So a residency program has to have an affiliate, which is usually a college of optometry. And so SCO does have several residency programs that are in-house or affiliated with SCO that are not local. But it does train you, gives you an advanced training. So if you just want to be better, faster, it gets you greater experience. Usually it's more independent, but you have a mentorship relationship. So of course, when you're done with that 4 years, you're going to be ready. But sometimes people are like, I want to explore a specialty aspect a little bit more. So if you wanted to get more exposure in ocular disease, or you wanted to get more exposure in vision therapy or low vision, or contact lenses, you want to get a little bit more exposure to that, or get better at a certain niche. There, you can do that through a residency. Or you just want to have a little bit more independence, feel a little bit more confident with your decision making, because you are under us at SCO, and so you have that staff doctor to fall back on. And in your residency, you still have a residency supervisor, but usually you're very independent. But when you get in a pinch, you have that supervisor that's still there. And they throw in some additional didactic training, so you get more scholarly exposure, more article exposure. You can do but sometimes doing a poster or a paper is a required aspect of your residency. So it just gets you a little bit better, faster. And there are some aspects of optometry that it's highly favored that you have a residency, or you may see listings that either you need to have 5 years of experience for a job or a residency. And that's usually how people equate it. If you've done a residency, it's about the same as 5 years of quality experience with a mentor. So a residency just opens up more opportunities for you. Usually if you did want to work in academics at a school, usually you have to have done a residency program. So again, when it's not required, but as you're getting used to things and you're just feeling, if you're confident enough or you just want to get some more exposure, residency is a great option for everyone. I highly recommend them. And SCO does offer more residency positions than any other school. So you get a lot of exposure to residency opportunities through SCO. Well, that's really a very, very quick overview, but if there are any questions, I'm happy to answer them now, or you can email me. My email address is here, but also I'm on the SCO website, so I'm happy to answer any of your questions at any time.
Yes, and for everyone with questions, there's a Q&A chat feature at the bottom of your screen, but you can also use the regular chat as well. So we'll give it just a few seconds to see if any questions come in. I'm not currently seeing any questions, but Dr. Elkins, I know something that comes up often when we speak with students is the question of how they can prepare for what they're going to experience in optometry school while in undergrad or while in a graduate school program. Do you have any advice on that point while we see if we have any questions from our attendees?
Absolutely. So preparing, I would try to take a higher credit load. I know a lot of times people are really trying to space out those more challenging ones, or if you're not as involved in service, being able to get involved in service while you're doing your clinics and your classes as well, but taking some of those higher level sciences, but thinking about what you want to do in your future as well. If you have a thought that you may want to run a practice or things along that line. So getting a little bit of business exposure is not a bad idea. But again, volunteering and really being part of your community, that's really a great idea. And just being able to handle the diversity of what you're going to do. So classes and clinics, and sometimes getting a job or volunteering so that you can really demonstrate that you have great time management skills, and just enjoy yourself as well. Don't want to burn out. Of course, you want to do great at the things that you do. Whatever you're going to do, make it better because you're there. But really trying to push yourself a little bit.
Thank you. Let's see, I'm still not seeing any questions. So I'll do one more ask. If anyone has any questions from our group, please feel free to go ahead and share them.
One thing we didn't really touch on a whole lot is research in and of itself. So SCO, we are very clinic focused, but we do have a research track as well where students can be involved in our summer research programs where you can work with a faculty mentor on a research project. I think we have maybe 8 or 10 students that in that gap between your first and second year is usually when those projects happen. So we do have a focus on research as well, but we just always want to make sure, even if you have that research desire, you can explore that here, but we want to make sure anybody who graduates from SCO, you're going to be a great clinician as well.
Alrighty then. Well, thank you. So, oh, there we go. Let's see.
Oh, there we go.
One come in. Oh, well, thank you. Someone who wishes to remain anonymous said, not a question, but I would like to thank you for the very informative presentation. Well, you're very, very welcome. And as Dr. Elkins said, you are free to contact her at any time if you have any follow-up questions. Oh, and here's another question that just came in. Please elaborate on the application process with regard to the external degree programs, HCMBA and MPH. Specifically, is there a GRE requirement for either program? When do students who are interested typically start the MBA or the MPH?
Oh, great. I'm glad you brought those up. So you can, as soon as you're accepted to SCO, you can actually begin the application process for, and if everybody's not familiar with this, the University of Memphis, we have an agreement with them with their School of Public Health. If you are interested in getting a master's degree in public health, they will accept, I think it's 5 credit hours of your SCO courses that you're already having to take towards the MPH degree. You do get a discounted tuition and you do not have to take the GRE. If you're accepted to SCO, then you can begin that process as soon as you're enrolled, essentially. They have agreed that even if it's the summer before you start, if you are accepted at SCO and you've made your deposits, we just have to verify that you're essentially an SCO student and you can apply there. So the same University of Memphis master degree in public health, but also with Christian Brothers University for their MBA degree or their healthcare MBA degree. They also accept, I believe it's 9 credit hours of your SCO curriculum towards that degree. And again, the discounted tuition and no GRE that you have to take, and it's the same stipulation. So most of those courses are online. And we do have people that it's not really a dual degree because SCO does not manage that degree, but these entities we've partnered with, that they have reviewed our syllabi, actually partnered with them to make these agreements, and they again take part of your credit. So if you were ever thinking about an MPH or an MBA, it's essentially the easiest it would be because they'll accept some of these credits. It's not easy in conjunction with also getting your OD degree because it's a challenge, but we always have our high achieving students, a handful of students that choose to do one of these degrees. And usually if you've started the degree and you're like, hey, I need to take a break, that's absolutely fine. You usually have 8 years from the time you've started that degree to complete it, as long as you've started it while you are an SCO student. So yeah, it's the most affordable way to get those degrees. Usually, again, you have the option to take them all online. I know for the MPH degree, and we usually have representatives from these schools to come talk to the classes in the first year, just to tell you a little bit more about it. But if you're already aware of it, you can actually start that program before you even start at SCO once you're accepted. So there's a lot of opportunities there. And a lot of times those master degree projects, you can use some of the things you're already having to do through the SCO coursework towards those master degree projects, if you can plan it out well. So great opportunities there. I hope that answered your question. If you have any more, I'm happy to elaborate.
Yes, thank you. That was an excellent question. I'm glad we were able to touch on that. All righty. Well, I'm not seeing any more questions from the group. If any other questions do come up, please feel free to email Dr. Elkins or us over here at admissions at any time. And with that, I believe we'll go ahead and wrap up. This brings us to the end of our webinar. Thank you so much for participating. Special thank you to our attendees and to Dr. Elkins. We hope that you have enjoyed the experience. Our next webinar is going to be in July, and we'll cover the interview process, where you'll hear from the VP of Student Services and gain insight into all of the key factors that we look for during the interview experience. If you haven't done so already, I invite you to request more information by signing up for our inquiry form. You'll receive a personal advisor and a personal brochure with information relevant to your goals and experiences. Thank you again to Dr. Elkins for your great insight and information. Thank you to our attendees. We hope to see you all in July, but in the meantime, have a great rest of your week and take care.
Thank you.